guys, it's Dr. Carter here at Lexington Podiatry, and as you guys know, we have a pretty good YouTube channel. Thank you to our patients for allowing us to do that. Well, we also get a lot of comments and questions about things that are unrelated to some of the videos, and we want to answer some questions. So we have patients that ask questions. We want to answer those. We have Sarah here today. She's actually kind of a patient, kind of not, also an employee. And she does our laser clinic line. So she gets to be involved with patients, gets a good one-on-one with them, and they ask her a lot of questions too. So we're gonna let her be the patient today and ask a question from an actual YouTube comment that we got a few weeks ago.
Hello. The question is, I would love to have some information about plantar fasciitis. I've had surgery on one foot along with my Achilles tendon. I'm currently having only the sensation of walking on a baseball under the outside ball of my foot. I have arch support inserts and good shoes. How can I help with the pain and avoid it progressing to my whole foot and ankle swelling and having surgery on that foot?
Okay, so that is a question and a comment that we get a lot even in the office. Plantar fasciitis is one of the things that we treat most often here, and it's actually one of the things we love to treat the most. So plantar fasciitis is an inflammation of a band of tissue on the bottom of the foot. It's kind of what supports your arch. So it's very, very important. When you stand, when you walk, high arches, flat feet, all of those things contribute to inflaming that piece of tissue. So it seems like Sarah had surgery before and she doesn't want to go back there. Inserts are an amazing way to try to prevent this from coming back, but you also have to do things like stretching. Stretching your whole entire calf muscle up the back of your leg can actually help the bottom of your foot. Sometimes it's kind of hard to see how those two things are linked, but your Achilles tendon in your calf connects directly to your plantar fascia and they kind of function as one. So when your calf muscle or your Achilles tendon is very tight, your plantar fascia doesn't function the way that it should. Stretching and orthotics are the ways to prevent this for sure. Now, obviously you've got your orthotics, there's custom versus over-the-counter. They can both be beneficial, but if you've already progressed to the point that you've had surgery on one, more than likely a custom insert is what you need. We can always do that here. We do a scan of your foot, and then a few weeks later, after we write the order for it, the device comes in. When you're treated here at Lexington Podiatry, we try to be very aggressive in treating the acute problem. So we want to get rid of your plantar fasciitis, but we also want to prevent it from coming back. So on that second visit when you come in, we've got everything you need, including your inserts and some stretching devices to help you keep this away for good. So that's kind of plantar fasciitis in a nutshell. I hope it makes a lot of sense. If you have any pain in your heel, in your arch area, or even up the back of your leg, make sure that you come see us. We can do so many things for it, including laser therapy like Sarah does for our patients. So make sure you call us and let us evaluate you, okay? I hope you have a great day.